Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you 5 ways you are unconsciously sabotaging yourself whilst your loved one is critically ill in intensive care, and how to stop doing it. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to talk about why having a loved one critically ill in intensive care is a once-in-a-lifetime situation, and why you can't afford getting it wrong. If you are experiencing one of your biggest challenges during your lifetime, and if you are facing having a loved one critically ill in intensive care, then I think I know how you feel, and I also think I know how I can help you. The reality and the fact of the matter are that the fear, the frustration and the challenge, the stress and the vulnerability you are currently experiencing, leaving you having no peace of mind, no control, no power and influence during this once-in-a-lifetime situation. And look, when I first started working in intensive care, I felt totally overwhelmed and challenged by what was happening all around me. My first few months working in intensive care were extremely challenging, and I wasn't sure then whether I could cope. Eventually I knew that I would, and if anything, I think I blossomed in the environment, finding a lot of inner strength and meaning by absorbing myself into the work. It also gave me tremendous insights about the psychology in intensive care, how intensive care units operate and what's happening behind the scenes. I also found that it's just as important to look after the families of critically ill patients than it is to look after the patients themselves. This is especially true if your critically ill loved one is not a straightforward admission to intensive care and is falling into one of the categories, such as your loved one is very unstable and in a very critical condition, or if your loved one is in a life-threatening situation, or if your loved one is or has been in intensive care for long-term treatments and long-term stays, or if your loved one is in intensive care with severe head and brain injuries, or if your critically ill loved one is approaching their end of life in intensive care. Those are the situations where you and your family might feel like shit hits the fan, so to speak, and those are also the situations where you think that you have no peace of mind, no control, no power and no influence whatsoever. And those are the situations where you and your family might feel like you are unconsciously or unconsciously realizing that you, your family and your critically ill loved one are in a once-in-a-lifetime situation. Think about it. If you are in a once-in-a-lifetime situation and you feel like the odds are stacked against you and you want to turn the situation around, wouldn't you do it if you knew how to? And that's where 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence tend to become passive and let things happen to them. Those families of critically ill patients tend to be so overwhelmed by the events that are happening around them that they let things happen to them rather than actively seeking a solution and a way out of the dilemma. Listen, you are in a once-in-a-lifetime situation, and the reality and the fact of the matter is that if your critically ill loved one is in one of those critical, difficult, life-threatening and challenging situations that I mentioned before, you simply can't afford to let things happen to you. I know it's very easy to get frustrated, angry, negative and passive in those situations. However, whilst you can't control what's happening around you, you can control your reaction towards it. Let's quickly look at some real-world examples. For example, if your critically ill loved one is in intensive care after they had a cardiac arrest, which is basically when their heart stopped. And if the intensive care team is telling you and your family that they think the chances of survival for your critically ill loved one are low, then you can do two things. First, you can just silently nod and believe that the intensive care team has been what the intensive care team has been telling you. Or you can do number two, you can silently take the message in and think to yourself that the intensive care team made a statement, but that you don't think that statement to be accurate and truthful, and that you believe that your critically ill loved one will survive and recover. Another example would be on the other end of the spectrum, where your critically ill loved one has been in intensive care for a couple of weeks now, and your loved one is very sick. They are ventilated, they are in an induced coma, they may need hemodialysis for kidney failure, they may have a severe infection, which is a sepsis, and they are just not getting any better. Your critically ill loved one is 86 years of age, had a good life, and you and your family just don't want to watch their suffering any longer. The intensive care team has been hopeful, and they have been telling you that your loved one has a good chance of a recovery. You and your family, however, feel that it's not the right thing to do, and you have this feeling that your critically ill loved one wouldn't want to be in this situation and that they would rather die. Again, you have two choices. You can just silently nod your head to everything that the intensive care team is telling you, just like society has wrongly conditioned most people for centuries. Or you can assert yourself about what you and your family think that you and your family want. If you do that, you will have peace of mind, control, power, and influence. The reality is that if you don't assert yourself, then the intensive care team will be making decisions for you, for your family, and for your critically ill loved one. If that's the case, and if you choose not to take action, not to ask the right questions, and if you choose not to look behind the scenes, you will wind up having no peace of mind, no control, no power, and no influence. In both examples that I've given you, you and your family need to realize that the intensive care team usually always has a hidden agenda in those situations where your critically ill loved one is in one of those challenging and difficult situations where they are either very unstable and in a very critical condition, they are in a life-threatening situation, your loved one may have been in intensive care for a long-term treatment and long-term stays, or your loved one may have had severe head and brain injuries, or your loved one may in fact approach their end of life in intensive care. The reality and the fact of the matter is that in any of those situations there is a lot at stake for you, for your family, and for your critically ill loved one. There is also a lot at stake for the intensive care team, and if you don't know what is at stake for the intensive care team, you might get this once in a lifetime situation wrong, and you and your family might be kept at arm's length, so to speak, by the intensive care team. If you don't understand and if you don't learn quickly that the intensive care team makes decisions behind the scenes and behind closed doors that are mainly based on other patients waiting for precious and scarce intensive care beds. The intensive care team's decisions are also based on the financial viability of your critically ill loved one's stay in intensive care. Hence, the intensive care team will weigh up whether they think they will make any money or they will lose money out of treating your critically ill loved one. The intensive care team's decisions behind the scenes are also based on their medical research interest. For example, is continuing treatment on your critically ill loved one interesting for the intensive care team and their medical research interests? Or are they better off reallocating resources to other patients where the intensive care team can perform medical research and therefore attract 5, 6 or even 7-figure dollar funding per year into the intensive care unit? The intensive care team will also make decisions based on their perception about the future quality of life of your critically ill loved one. After all, keep in mind, it's the intensive care team's perception about quality of life, and it's not even real. If you and your family don't control your reaction to any of the positioning that the intensive care team might have about your critically ill loved one's prognosis and diagnosis, you won't stand a chance to get this once-in-a-lifetime situation right. Controlling your reaction, asking the right questions, and knowing what your critically ill loved one would want and what they would be prepared to put up with, and also knowing how resilient they are. They are the tools in your toolbox. Use those tools wisely, because they are the tools for you and your family, so that you can have peace of mind, control, power, and influence. How can you have even more peace of mind, control, power, and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How you can eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care. And how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer all your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.